your hormones are dynamic. They're meant to change throughout your life. That can make them notoriously hard to understand and hard to interpret. This is your period giving your body a warning sign, and it's time for you to go pay attention to it. Just because some transitions might be normal, that doesn't mean you have to suffer in the in-between. Smoking, marijuana, alcohol, excess use of all of these can be extremely problematic to your fertility. That is something that I wish I'd had testing for my fertility well earlier. Hi, friends, and welcome back to the show. I'm so honored to have you here today on my birthday. And we're going to dive into what I want you to know about your hormones, but more importantly, how to optimize your health at each decade of your life, no matter where you are in your reproductive journey. This is largely the core of what the fertility formula is, the information I wish I had known at an earlier age, and the foundation of support so that you can optimize your reproductive health. You can learn more about the fertility formula at nataliecrawfordmd.com/book, as it's available for pre-order now, and you can join the book club. But today we're really talking about these different decades and learning to lean in to what your body is telling you. So let's dive through them all really quickly. So in your 20s, this is going to be a time when many of us are actually not thinking about our reproductive health. Maybe we want kids one day, but not yet. And this is honestly a missed opportunity for many of us. If I look back on my 20s, one thing that I know is that not getting pregnant was the key. And I think understanding different contraceptive options, the pros and cons, and making the choice that's right for you is, of course, paramount. But one thing that I wish I had done differently was learn a little bit more about what was normal for my body. You see, I was on birth control pills and continuous birth control pills for over a decade, for all of my 20s. I never learned what my normal cycle should be. Now, the birth control pill was wonderful. I have nothing against it. It definitely served me, but I wish I'd been at a moment where I could have taken a break and learned about, was I having regular cycles and what my normal looked like, in addition to learning more about how to track my cycle and learn about my ovulation. These were things that I learned so much later in life. And maybe I would have been less afraid of learning to track a cycle or what hormonal change happened. Because when I stopped my pill when we did want to get pregnant, not only was I in a position where I had no idea what was normal, I didn't even know what to do. This is a time period where for many of us, our bodies are in a nice cyclic rhythm. So if you are preventing ovulation, which is typically going to be through oral contraceptive pills, maybe an Implanon or the Depo-Provera shot, you won't be able to track your cycle. But for many others, you actually can track your cycle, and not all contraceptives prevent ovulation. But learning to track your cycle, learning about the estrogen ebbs and flows can be hugely advantageous, regardless of contraception or not. This is a time of your life where your body is laying down the foundation of your muscle, your bone, and your brain resilience. And yet, this is not a time that we talk about. It's also a passive time where your eggs are inside your body and maybe you're not trying to get pregnant yet, but the sum of these decisions that you're making can influence your egg quality later, because we know that your inflammatory burden or the total amount of inflammation that you experience over your lifetime can actually impact not just the quality of the genetics inside your eggs, but their competency, their mitochondrial health, and how they function. So learning to have a really great foundational health system, learning to decrease inflammation earlier on is only going to serve you more in the long run. So what I want you to do if you're in your 20s, this is the time to set a good foundation. Learning about sleep, stress, and exercise, no matter what you're doing for contraception, is going to be key here. Let's set the foundation of your health now for the future. And I want you to learn about different contraceptive choices to make sure that you're picking the right one for you, and consider learning how to track your cycle, whether this means a break from contraception if it makes sense, or just when you're stopping. Make sure you're stopping contraception early enough before you want to get pregnant. Personally, I like about 6 months. That way you can track your cycle, learn the nuance of what's normal for you, go and get help if things are not normal well before you want to get pregnant. So what are we going to focus on for sleep, stress, and for exercise if you're in your 20s? Number one, sleep. This is probably what most people in their 20s are not doing enough of, and I know I certainly wasn't. I was one of those people who would wear the badge of honor on my chest that I only needed 4 or 5 hours of sleep. Like, that was something to be proud of. But what I want you to understand is that if you're in your 20s and you're not getting enough sleep, you are constantly performing at less than your optimal function. And this isn't just about feeling good. This is also about your hormonal health, how your brain interprets hormone signals and can respond to them, and how your ovaries are going to respond and the quality of your eggs. And we want your ovaries to respond well into your future. We want ovarian longevity. We want to have as many eggs as we can so we go into menopause later and we have improved health outcomes. So I want you to aim for 7 to 9 hours of sleep a night. I want you to really think about what that means. You might have to say no to certain things in your life in order to make this happen. I don't want you to sacrifice sleep for exercise. If you only have to choose one, get more sleep. I want you to make sure you're setting a cool room environment and maybe you have roommates or you're in a loud place. Consider a sound machine, earplugs, sleep mask, whatever it takes. But probably the number one detriment in my patients when it comes to their sleep is actually going to be their devices. How often do we say, I'm going to go to bed at 9 p.m. and then you get in bed with your phone and you're scrolling? So really think about putting your phone away from you so that it can be less of a distraction. I love melatonin about 30 minutes before you want to go to bed. Melatonin is an antioxidant hormone made from the brain that will help calm things down, also decreases inflammation. But the key with melatonin is to make sure you're not taking too much. So we really want to make sure that you're not over-treating or taking too much. For most people, we don't want you taking any more than 3 milligrams of melatonin a night. And for most, honestly, 1 milligram is probably sufficient. But that might be a child's melatonin. This is something where we often hear people say, oh, I feel too drowsy the next day, but they might be taking too much or they're taking it too late or they're missing their opportunity to go to sleep. So get in bed, put your phone away, take your melatonin, think about a meditation, set a good environment, and start working on getting into a good circadian rhythm where on most of your days, you're setting a good foundation for your day. Sleep is when your body heals from inflammation. It's when your hormone levels are made. It is when your body prepares to face the challenges of the next day. I also want you to exercise smart, understanding that this will be the easiest time in your life to build large amounts of muscle, and skeletal muscle can help you build and it can help you protect your future. We know that muscle can be one of the organs of longevity, but your muscle is really important because it can also lower inflammation and insulin resistance. So building and using skeletal muscle. This doesn't take some crazy plan, but strength and resistance training at least 2 to 3 times a week is really key. So set aside that time for you as a priority. And then be really mindful about stressful behaviors that are not going to protect your fertility in the long term. Smoking, marijuana, alcohol. Excess use of all of these can be extremely problematic to your fertility. It can hurt your egg quality. And smoking cigarettes is a great example. We know that women who smoke have a harder time getting pregnant and they go into menopause earlier. To put it simply, smoking decreases your ovarian reserve and predisposes you to premature menopause, and that's not something that you want to go through. So in addition to just how your hormones function, the inflammation levels that some of these toxins have in your body is not great for day-to-day exposure. Does this mean you can never have a glass of champagne if you want? That's not what it means. But if you're making proactive anti-inflammatory choices, if you're building muscle, you're eating nutrient-dense food, you're getting enough sleep, you're going to be able to tolerate some of those inflammatory circumstances. And maybe it's cake or maybe it's champagne a lot easier. So don't wait until you have problems to make changes. Use your 20s as the time to build that healthy foundation. Also, learn to track your cycle if you're not on contraception. Use fertility awareness methods. Learn about basal body temperature. Consider getting a wearable. Do something that's going to make it easier for you when you want to get pregnant later. And then please do not hesitate to get an evaluation. When you're not trying is the key time to optimize your health. So if you have irregular cycles, really painful periods, if you're bleeding through your clothes, this is your period giving your body a warning sign, and it's time for you to go pay attention to it now. Moving on to your 30s, this is when your fertility really starts to become a player. We know that throughout your 20s, both egg quantity and egg quality for the average person are relatively high. But throughout your 30s, you start to see a decrease in the number of eggs inside that vault, and you're going to see a decrease in the quality of these eggs as well. Throughout the course of your 30s, you're going to see a drop in your monthly rate of getting pregnant, an increase in your monthly rate of a miscarriage. This isn't something that you just have to be a passive bystander to, but to the woman in her 30s, understanding your body is even more important. Advocating for early testing, really having a conversation with yourself about, do I want kids? What is my ideal family size? Is this a life goal for me? And not being a passive player in your life. This is my big plea to you in your 30s. So really learning to track your cycle is even more important now. Starting to pay attention to inflammation in the world around us. If you didn't do a good job in your 20s, this is your moment. We know in the 30s is when most women start to develop autoimmune disease, thyroid dysfunction, weight gain. Our bodies start to change. Our metabolism changes. right in proportion to how our hormones are changing as well. So, really think about, should I get my ovarian reserve tested? Should I track my cycles? And should I get any of those problems evaluated? That is something that I wish I'd had testing for my fertility well earlier. But I grew up in the era of you can't get testing until you have problems. I had to suffer through multiple pregnancy losses before I'd even get an evaluation. You don't have to fail first. I challenge that constant narrative that says failure is what's required to get an evaluation. So learn to be an advocate for your own health. Yet you can't advocate for something that you don't know is wrong. So this is again a time where understanding your baseline and your normal is even more important. Your 30s are about balance. And where I want you to start to really leverage in is learning more about insulin resistance in your 30s, because we know insulin resistance is one of the top drivers of inflammation, and chronic inflammation hijacks your fertility. So I don't want you to say, oh, I don't have diabetes, or oh, that's not in my family, or I don't have PCOS, so I don't need to worry about this. You live in an inflammatory world. Insulin resistance is impactful for your ability to get pregnant, even if you don't have PCOS. And often, lab levels that define what insulin resistance are population based norms, and they're really not optimal levels. So, let's start to look at how do we lower insulin resistance? But that begs the question, what is insulin resistance? Here's the analogy you may have heard if you've been around here. Insulin's a hormone, just like many other hormones. And insulin's job is to get glucose from your bloodstream into your cell. Well, when you eat, your nutrients are broken down into glucose, which is the food for cells. Insulin's a hormone released from the pancreas in response to glucose. So, in a perfect system, you eat food, glucose increases, pancreas secretes insulin. Insulin allows glucose into the cell, glucose levels lower, insulin levels lower. And this is the normal rhythm our body should be in when we are exposed to food. What's happening is we're living in a world now with foods that are not natural and not normal. Highly processed foods have high glycemic indexes, meaning your blood sugar raises more and stays elevated longer. In addition to, there's so much snacking. Think about watching TV or being out with friends. We're constantly eating, and sometimes we're not even aware of it. Allowing our bodies to have a constant glucose load, and that means insulin is also going to be chronically elevated. Well, if we imagine that insulin's like a salesman coming to the door, if the salesman's knocking on the door every single day, you're going to stop answering. You're just going to simply stop answering and say, I know what that is. That's what insulin resistance is. Your cells become immune because they see this salesman all the time. And so we really need to start to fight this system. And yes, there are insulin sensitizing medications that sometimes we need, and that's an option. However, I'd rather you start from the root cause. And in the perfect world, I'd rather you prevent this from even being a problem. But how do you prevent something that you don't even understand what it is? Insulin resistance is multifactorial. So it's the idea that that salesman now has to bang on the door for you even to open it. That is insulin resistance. Your cells get sick of seeing the signal. So how do we fight this? One approach is with the foods that we eat. And this is a time that if you haven't before, really start to leverage the foods that you eat being both helpful or anti-inflammatory and avoiding those that are pro-inflammatory. High glycemic index foods, ultra-processed foods, added and artificial sugars do not belong in your diet on a day-to-day basis. And we need whole foods, real nutrients, high fiber diet. This is going to help your gut microbiome, improve your gut health, decrease inflammation from the source, but also improve the integrity of how the gut allows glucose and other nutrients and inflammatory toxins into your body. If you're simply not taking foods in that have a high glycemic index, you're not going to be releasing as much insulin. So that's one thing that can be helpful. But if you're already on this pathway of response, you often have to step back a little bit more. So how else can you help this? Building and using skeletal muscle is one of the keys that you can do, because the more muscle you have, your skeletal muscle has a transporter called GLUT4, and this allows glucose to get into the cell without needing insulin. Well, it's like giving glucose a key to the cell. If I can lower your blood glucose levels, you're going to have less insulin, and this ultimately will help fight this process. High insulin levels actually cause your body to store fat and visceral fat, the really harmful kind. It's a growth hormone. So we really want to switch how we think about the role of skeletal muscle, and that muscle composition is so important. Exercise is not about just being a certain body size. We want to build skeletal muscle for our hormonal health now and for our longevity later. Also, though, improving insulin resistance means focusing on getting more sleep and combating stress. So it's really a multifaceted approach. So, if we focused on sleep as one tenant in our 20s, then in your 30s, I really want you to focus on how you're going to combat insulin resistance. And of course, that's a multifactorial approach. From your fertility, if you haven't yet, track your cycles. Stop hormonal contraception if you want kids one day but not yet, and learn if your body is normal. Consider getting an AMH or a test for ovarian reserve. I understand this can be controversial health information that I completely disagree with, but understanding if your egg count is low now can help you make important decisions for your future. We need to know that it does get harder to get pregnant as you get older, but this means lifestyle approaches are even more important. So, really learning how to live that anti inflammatory life, and then consider, does egg freezing or an earlier intervention make sense for you? You don't know what you don't know. So, get tested, see a fertility doctor, and learn more about freezing your eggs if having kids truly is a life goal for you. Because the longer you wait to start your family, the lower the odds that you might have that dream family, especially as you start to get into your mid 30s and beyond. Also, regardless of where you are, starting to incorporate those anti inflammatory foods and supplements. So, I love everybody to be on a prenatal vitamin with folic acid, coenzyme Q10, vitamin D, and omega 3 fatty acids. These are nutrients for life. They can help you if you're trying to get pregnant, they can help with hormonal health, and they can help you long term, even when you're in that stage where your family's completed, but you're not yet going through perimenopause or menopause. All right, welcome to your 40s, and this is where I am. And this is for most people when perimenopause really starts to kick in. Menopause, by definition, is the absence of having a period for 12 months and being an ovarian failure. It's simply one day in medical world. That means you have to be an ovarian failure for 12 months before you even get to it. The most important thing you can do is learn to track your cycle and identify these cycle abnormalities and early changes, which are extremely subtle, to help you understand when you're entering into perimenopause. Perimenopause can be the 4 to 10 years before this is happening. Essentially, what begins to happen, and how I explain it to my patients, is this is diminished ovarian reserve. The number of eggs that you have in your vault starts to decrease. And because we know that when there's more eggs in the vault, more come out every month, when there's fewer eggs in the vault, fewer come out every month. And this means the ovary starts to become more stubborn and less predictable. You start having what is frequently known as a chaos moment. Estrogen levels can widely fluctuate. Your ovaries may not respond to prior signals that they used to. And this means that interference of this HPO system, the hypothalamic pituitary ovarian, become even more impactful. And so this is when chronic inflammation, insulin resistance, and the world around us really start to catch up with us. So if we haven't learned those good habits earlier, you're sure going to see them in these periods of hormonal change. This is also when a lot of women tend to get gaslit. I've heard Mary Claire Haver say the number one symptom of perimenopause is not feeling like yourself. This means you've got to know what yourself feels like, what is your normal, so that you can go and get help. And if you're being gaslit or somebody doesn't believe you, go see somebody else. There's plenty of people who will believe you, because going through perimenopause is like going through puberty, but in reverse. It's a new transition. Your body doesn't know what to expect, and your body loves predictability. You also might be perfectly regulating normal. You might have no problems. And this can also be confusing if you hear so much buzz about perimenopause. Let me tell you what most women experience. As the number of eggs in the vault decreases and less come out every month, the brain doesn't know this and starts to send out a normal amount of FSH. If you have fewer eggs, that FSH signal is going to be a stronger signal to each egg. This means you're going to ovulate shorter. You'll start to ovulate sooner in your cycle. You will ovulate. At first, you'll still have a normal luteal phase, but the number one symptom I see of diminished ovarian reserve, which is the same thing as perimenopause, is a shortening of your cycle. So any woman who tells me my cycle used to be 29 to 30 days, but now it's 24 to 25, I have a huge red flag waving saying her egg count is dropping, she's in diminished ovarian reserve, and this could be perimenopause. So you don't know that if you don't know what your normal is. So learn to track your cycle. We then just start to see luteal phase abnormalities. You'll then start to have a stubborn ovary as the egg count drops even more, and you're going to start to ovulate later. So you'll go from these short cycles to then these longer cycles, and you're going to say, what is up with my body? And then you're going to go into some irregular cycles. But if your doctor is simply asking, is your cycle regular? You may very well sit there and say, yes, because it is. But is it different? That's key information. So remember, your doctor can only work with the information you're giving them. So know what used to be normal for you, which hopefully meant you were tracking your cycle in your 30s, so that you can clearly explain what has changed. Any change always needs to be evaluated. And these last years of estrogen are even more important for really finessing out some of the habits that we need to carry us through the menopausal transition. So, building bone, improving our brain health, really setting ourselves up for success becomes even more important. I don't want you to think of this as a problem. Like, this is a transition. We'll all go through transitional times in our life, and life's all about change. But knowing what to expect and how to adapt is how you're going to get through this in the best way possible. So, if in your 20s, you focused on improving your sleep parameters, and in your 30s, you focused on fighting insulin resistance, here in your 40s, I really want you to start thinking about how do we optimize our muscle mass and how are we dealing with the world around us. In order to build more muscle, the foods you eat become even more important. Chronic inflammation can be detrimental to trying to achieve this goal. So I want you to eat diet high in fiber, those whole foods, avoiding the processed foods, and increasing the amount of protein that you're exposed to. Creatine has benefits for building muscle, but also for brain health and longevity. So look at the foods you're eating and see if you need to supplement. Think about resistance training as the key. I understand that many of us, especially if you're my age or close to it, are entering into this transition from a place of previously leveraging exercise to be a certain body size. But I want you to view exercise as a tool to build muscle and as a tool for you to combat insulin resistance and the changes that are coming. In fact, we know that as you enter into that menopausal time, that the rate of osteoporosis and serious complication is even going to increase more. So really leaning on how are we going to enter this transition with the peak muscle mass we can. And that for most women is going to be working up to lifting weights. 3 times a week at minimum is what I recommend. Start with body weight, learn to pick up weights. There's no one perfect exercise plan for everybody, but starting somewhere and being consistent is more important than not. We also see more sleep problems in this transition than anything else. And it's because your body's like a toddler. It loves reliability and predictability. So when you start to see hormonal changes, you're going to start to see that it's harder to sleep, especially because progesterone is so important in the sleep transition. In this time period, I want you to start to learn those good sleep practices. And if you haven't in the past, really do consider magnesium, melatonin, and shifting of your sleep environment. Hormone replacement therapy is something you should consider, and we have emerging data that perhaps starting it in the perimenopause timeframe can be helpful to you long term. This is going to look different person to person, and there's no one size fits all approach. But especially if you are having symptoms, this is something you should bring up to your doctor. Symptoms classically are going to be not feeling like yourself, brain fog, difficulty concentrating, irregular cycles, weight gain, bloating, low libido. It's going to look different for all of us, but learning how to say, oh, this is my hormones and I need to work with it is going to be key to getting through this transition to the other side and the healthiest, happiest place that you can. For blood work, if you're having cycle abnormalities, this is a time where a lot of women are diagnosed with thyroid abnormalities, prediabetes. So make sure that you are going to your preventive visits. Make sure you're bringing up screening for thyroid disease and a hemoglobin A1C. In addition to, you can always ask for an AMH to see where your egg count is if it's something that you're concerned about. You still can get pregnant in your 40s, but your odds are going to be lower than when you were in your 30s. This means lifestyle factors, tracking your cycle, seeing a fertility doctor earlier are even more important. In your 50s and beyond, we really want you to start thinking about longevity if you haven't yet, and thinking about balance for the long term. Menopause means ovarian failure, and there's no one way to go through menopause. There's a lot of people advocating for different things. I can tell you from my experience, I'm a fan of estrogen replacement, but that's because of how I've trained and what I have learned and what I have seen. But I know that the female brain loves estrogen, and for many women, it can be a game changer for how they feel and for feeling like themselves. Of course, if you still have a uterus, you can't take just estrogen alone. You also actually need progesterone. And this is because unopposed estrogen or estrogen only can predispose you to developing uterine cancer, endometrial cancer. That's different if you're still cycling. So if you're still having a normal period, you might supplement with some low dose additional estrogen and you might still be ovulating. So hormone replacement will look different at different moments of your life. There have been a lot of fear tactics that have kept women away from hormone replacement. Some of these are studies like the Women's Health Initiative. That wasn't a properly designed study where women actually started hormone replacement therapy in their mid 60s and beyond after being in menopause for many years, and was terminated early, and some of the initial outcomes that it showed have actually been disproven. So you need to make hormone decisions from your doctor. For the most part, when somebody gives you an all approach, all hormones are bad, or this is something I never do, I always wonder why. Why is there not room for an individualized approach to medicine? So, if you are going through menopause, if you're in that perimenopausal transition, if you're starting to have hot flashes, night sweats, we know at this moment your body is really not making much estrogen. The brain is really starting to send out those high levels of FSH, asking the ovary to please, please make estrogen, and it can't. And these are signs that you are entering a transition and you do need a game plan. So, in addition to all the things that you've already learned, right? Sleep, an anti inflammatory nutrition approach, building muscle, learning how to fight insulin resistance. I want you to have a hormone therapy that's going to work for you or not. I want you to not be afraid to learn about your body and change. But I also think now more than ever, it's really important that we learn how to deal with stress. And hopefully, this is something we learned earlier. But the world is stressful. This transition is stressful. Stress itself on a chronic level is also inflammatory. I'm going to worsen everything else. So, if we view menopause for longevity, we want to come into it as a place where we know we're doing everything we can to help our ovaries function as long as possible, but also to make that transition as graceful as we can. So, fighting chronic stress is both knowing what to do when you experience acute stress, but also how do we prevent it? I know a lot of people going through menopause, and they say this is a time where we're not really caring anymore. And I think that's great. I wish we could have that mentality sooner, where we can start doing things that serve us with less regard to how the world around us thinks we should be doing them. But this is your last time, meaning it's now for the end of your life. How are we going to approach the second half of our life? What is going to be important for us? And I bet for most women, you feel like I do. I'm viewing my life as I don't want to just live as long as possible, but I want to be as healthy as long as I can. And so I want you to embrace this transition, knowing that anything you can do to decrease inflammation will make you feel better. Knowing that hormone replacement isn't universally good or bad. And for a lot of women, it can be life changing. And I want you to learn about it. I want you to focus on your brain health, right? So this is stress and stress based methods, but also how do you keep your brain going as long as possible? How are you going to challenge your brain? What nutrients does your brain need? What are you going to do to keep yourself in the game as long as possible? And the last thing I want to say is sex is not something that we should have to give up. As sex drive naturally decreases as estrogen levels lower, that doesn't mean your body is meant to not have intercourse anymore. Your vagina is use it or lose it, meaning the vagina is a mucosal tissue. It is largely estrogen dependent to have its right stretchability and contractility. And it might be that sex becomes more painful as you go through menopause. But the more you have intercourse, the better it will be. And so, do you need more lubrication? Do you need local vaginal estrogen treatment? That can be hugely important to decrease recurrent urinary tract infections, which can lead to kidney disease and kidney failure and sepsis, but also to improve your sex life, improve your relationship dynamic. So I want you to think about all aspects of life are important, your relationships, your health, your sex life. And I want you to have a game plan to know that just because some transitions might be normal, that doesn't mean you have to suffer in the in-between. So your hormones are dynamic. They're meant to change throughout your life. That can make them notoriously hard to understand and hard to interpret. But what we should strive through every decade is proper communication. And that's what I consider hormone balance. Your hormone system's properly communicating, your brain, your ovaries can interpret what's going on, and it's sending out the best signal it can with less inflammation. View each decade as a building block so you can focus on something different. Of course, the better you can do all of them, the sooner you can, the better your long-term health is going to be. But understand that your needs are going to change hormonally through your decades, and what can you do in each decade to be set up for success. And of course, understand that your hormones are a communication system. They're like writing the story of your life, and you deserve to be the author, understanding what should be optimal, what choices you want to make, and we want to be making decisions from a place of data, because you can't make decisions on data that you don't know. Thank you guys so much for being here today. Learn more about fertility, health, hormones, lifestyle, and inflammation in my book, The Fertility Formula, available at nataliecrawfordmd.com/book. Thank you, friends. Thank you for listening to the As a Woman podcast. If you're ready to take control of your reproductive health, my new book, The Fertility Formula, is your next step. It's a science-backed guide to understanding your hormones, optimizing your fertility, and owning your reproductive future. You can order your copy and learn more at nataliecrawfordmd.com/book. And as always, follow along at Natalie Crawford MD for even more support. Because knowledge is power, and your health deserves a formula made just for you as a woman.